when we first came across the need for HIPAA compliant marketing, the Compliancy group became one of our strongest partners when it came to putting together our systems, making sure all of our team members, all 200 of them plus, to be essentially informed and educated and actually set competency on what they're being updated with every single year. So Liam Degnan, he is based out of New York. I've had a chance to talk to Liam a couple of times over the last couple of years, actually, and we go with their company as the sole provider to keep us in the loop of what we should watch out for, what we should be aware of. Liam, if you want to share your story, tell us a little bit about where you're coming from, what you did before this space, and how you work with agency owners, and let's dive right in.
Yeah, awesome. Thanks for having me, Paulson. Appreciate it as always. And I'll say my background is really in sales. So kind of it's a very long story of how I actually came to Compliancy Group, but I was actually doing insurance sales out of an agency in New York City for 4.5 years, and it was shortly after my first son was born. I It was a complicated situation, but I basically lost that job, right? Needed to find a new position. And I started looking into new and different types of industries. And I came into uh, really like the SaaS world, the SaaS and the software world. Compliancy Group is actually a local company for where I was at. Um, and it was actually, at the time, it was the first job that I applied to. It was the only interview that I went on. And 4 years later, I'm still here. Yeah. So uh, my role still at the company, when I was hired, was in sales. So a lot of my own experience and expertise is really from a sales perspective. I moved into handling a lot of our strategic partnerships. So actually moving away from doing selling just on myself to helping our partners succeed, either in the selling of their own products as well as our product. And then even transitioning now, my role, I'm actually directing our outbound sales teams, along with handling other different types of strategic initiatives internally. So I wear a lot of hats, but I have spoken, I don't know, probably with dozens of high-level agencies over the last 2 years or so. You guys are always actually my favorite people to talk to be honest. You'll have great businesses, and it's always, uh, there's a lot of uniqueness, I'll say, to the digital marketing space that makes pursuing healthcare sometimes uniquely challenging, but also actually uniquely profitable in terms of the value proposition that you can have depending on how you're approaching that space. So I'm here to just help figure out the best way to do that.
So Liam, I wanna set the stage right, and I know there's a couple of white elephants that we have to address. Early on, I would say 2016, around that time frame, there was a whole wave of agencies that were just trying to run around and trying to figure out, well, does a marketing agency have to be HIPAA compliant, and if so, why is that? Are we considered, a medical provider, or is it a clinical guy's problem? Like all these different questions came about. So can you set the stage pretty quickly, if you don't mind, of just creating relevance of why HIPAA should be something and a marketing agency really takes a look at, And then from there, feel free to share your slides and we can go right into
Yeah.
our full overview.
Well, I just, the first slide that I have actually is designed to answer that question. So
Okay,
if
well,
you
let's
don't
go right
mind, I
into
could
it. Yeah.
actually, yeah, I could go ahead and bring it up. And I think that in general, I wanted to actually start by just talking generally about some of, call it the basics when it comes to HIPAA compliance, because I think that for a lot of you on this webinar that have experience marketing in the healthcare space, and that's a target vertical for you, some of this might be super redundant, but then for others, I think it could be really valuable and just setting up the foundation for the rest of our conversation. Because generally speaking, super basic, there are really only two buckets that you could fall into as far as HIPAA is concerned. You could either be what's called a covered entity under the HIPAA rules, or you could fall into the category of a business associate. And basically, again, to make this super simple, a covered entity is a healthcare practice, specifically a healthcare practice that is billing insurance for the services that they provide. So if you're working, let's say if you have like a one-off nutritionist or a chiropractor, and they're not billing insurance, you don't really have any direct HIPAA exposures there. The real HIPAA exposure for most of you that are providing services to a covered entity puts you into the category of a business associate if you have exposure to patient data, right? So specifically under HIPAA, it's considered PHI, protected health information. And this comes in many different forms. So oftentimes in agencies, you'll be involved in the lead gen process, which has much less exposure as far as generating leads for the practice, because those people are not patients yet, right? But eventually, if that person became a patient and that data is inside of your system, that becomes PHI. Others of you that are more involved in the let's say general digital presence and retention with your healthcare clients. Like let's say you're running email campaigns out to their base, you're getting involved in scheduling, or you're running the high level platform, really more selling it as a SaaS tool to those practices, and they're storing patient information in it as a result of that. All of those different areas give you exposure to PHI, usually puts you into the category of a business associate under the HIPAA rules. And so this is where you might find your practices are asking you to sign business associate agreements. You might find that there's questions about this coming up in the sales process with those healthcare clients, or maybe down the line on their renewals and things like that. So generally good just to have an awareness of even what those terms mean. Because if your clients are in healthcare and they're billing insurance and you have exposure to that data, you fall in directly or indirectly under the HIPAA rules. Right. And I could talk a little bit about just even what HIPAA is, what it requires, especially for all of you as agencies. In general, HIPAA was built to be a specific set of rules designed to facilitate the protection of patient info, right? So privacy, security. There are really only three HIPAA rules: the privacy rule, the security rule, and the omnibus rule. Lots of different types of safeguards required under here. There can be a lot of complexity to kind of dispel the fog a little bit as far as what HIPAA ultimately requires. The highest level requirement of the HIPAA rules, you could say, is that you have to, whether you are a covered entity or a business associate, it's actually the same, is that you have to have what the government would call an effective compliance program, okay? And ultimately, an effective compliance program, you can think of this from the perspective of general security and general privacy, but really the HIPAA rules are built to be a very specific set of actually annual requirements that have to be completed and documented, usually once per calendar year, if you are either a covered entity or a BA. And so that could be things like an annual risk assessment is a requirement of HIPAA. Annual updates and reviews of things like HIPAA policies, procedures, trainings for your staff, the signing and then the tracking of things like business associate agreements, right? All of that stuff comes as a direct requirement of an effective compliance program. And something that I'm sure have come across this for those of you that are in healthcare is dealing with even things like business associate agreements. And I'll open this up actually for some questions in just a second, but a business associate agreement is required under HIPAA because if there was no legal document distinguishing the sharing of patient information, there's a never-ending chain of where all of that data could be winding up, right? So let's say a healthcare practice contracts with one of you, you contract with High Level. Let's say High Level has a hosting service. The hosting service has another provider, right? There's this never-ending network of people that could then have exposure to that patient data. So the law basically states that anytime that there is an exchange of PHI taking place, there has to be a business associate agreement in place that makes those responsibilities very, very clear. It's required prior to any exchanging of PHI, and could be required from a covered entity working with you, could be required of you working with another outside third party, like in this case, High Level, right? That you are also working with that could have access to that data. And so let's call it, you could say, some of the real basics as far as HIPAA is concerned and the way that it usually applies to agencies. Are there any questions on any of that? Because I think it might be good to spend some time just clarifying some of this.
Yeah, anybody want to unmute and ask a question? Feel free to raise your hand with that emoji reaction thing on Zoom. And what I can do is go through it. I see Mary Sue. How are you, Mary? Hope you're doing well. If you want to ask, feel free to do that.
Thank you. I don't generally work with like true medical companies, but I do work with like health coaches. And I have this one lady who's a spiritual coach. They feel like they need to be HIPAA compliant. And I don't see how they even fall into the realm.
Sure. So, well, I mean, there's two ways of looking at it, right? Because there are a lot of businesses that don't need to be HIPAA compliant that go through the exercise of it for marketing purposes, right? Because let's say I'm a health coach, I might have a stronger value prop to my clients if I'm openly communicating that I'm taking their privacy and security seriously, right? Same goes for you as agencies, right? If you are openly marketing yourself as a HIPAA compliant agency, that actually has a lot of power to it, because especially in the healthcare space, the other people that they might be speaking to may or may not be doing that, right? And it gives you a higher level of expertise in terms of how you're perceived. Now, a health coach, I'll say generally, would not fall under the HIPAA rules unless they're billing insurance, which would be very surprising to me that they were.
Right.
So my recommendation would be to just ask them, like, if they are billing insurance for any of the services.
Well, yeah,
that
none
they're
of
providing.
them are. Let me just say that. That's why I think it's kind of silly. They're not billing insurance. That's the way I've read the HIPAA rules.
Yeah. And is this just like a one-off client, Mary Sue?
I feel like all these health coaches have gone to some conference and they've been scared into believing they need HIPAA when they actually don't.
Yeah, that may well be. I'll say sometimes what happens is they get mingled into the broader behavioral health space.
Mm-hmm.
And many like behavioral health therapists do need to be HIPAA compliant, which can sometimes create some issues there. Depending on how often you're encountering it, chances are they probably are not doing what they need to be doing anyway to be HIPAA compliant, right? And this is obviously more motivated by fear. There are lots of different ways that you could go about addressing it, but they more than likely don't fall under the HIPAA rules at all. Right, whether or not they want to be, it's up to them.
Yeah, your whole marketing perspective makes sense to me.
Yeah. Well, I'll say we have a lot of people that actually come to us that don't need to be HIPAA compliant, that want it purely for marketing purposes, which is an interesting angle for sure.
Liam, there's a few questions that are repeated, so I want to just give you one of those. One is from Joe Tran as well as Eric Dunn. What if a cash practice like med spas? Eric says med spas and plastic surgeons that don't accept insurance. Do they need to be HIPAA compliant if they're functioning off of cash? Is that a thing?
First thing I'm going to say is a quick disclaimer that nothing I say on this webinar is legal advice, okay? So I am giving my honest opinion, right? But this is not legal advice. I'm not a consultant or a lawyer. I can only share from my experience. If they are not billing insurance, so in order for somebody to be a covered entity, they have to be processing what's called a covered transaction, in this case, which is the actual billing of an insurance company. And that goes back to even some of the history of the HIPAA rules, because HIPAA stands for the Health Insurance Portability and Accountability Act. And it was originally passed actually only applying to the health plans to make sure that when an employee changed companies, they had portability and accountability in the maintenance of their health insurance, right? That wound up becoming more broadly expanded to the practices that were billing those insurance plans, and then to the vendors that were working with those practices. So without that covered transaction taking place, in this case, the billing of an insurance plan, there's really no way for them to be directly covered under the HIPAA rules. There may be some extemporaneous circumstances there, like let's say from a more general privacy perspective, that also will change a little bit if you are in the state of Texas, okay? The state of Texas has a bill called House Bill 300, which very specifically in the state of Texas, there is an expanded definition of a covered entity, which includes general healthcare providers. So Eric, if you happen to be in the state of Texas, that may be the one area where there is a little bit of a difference. But it depends on how, if you would categorize a med spa, let's say, as a healthcare provider, right? So that would be something, something worth talking to a lawyer about. Yeah.
Let's go with Michael Hodges and then Jordan, and then after that we'll go back into the slides and push through, and then at the very end of the webinar, guys, we'll do a formal Q&A as we go through this. Okay, so let's go with Michael.
Hello, how are you guys doing?
Nice to meet you, Michael.
Okay, my space is the independent pharmacy space. I was a pharmacy owner for years. I sold my business, and now with the high level platform, I'm putting together some marketing services and targeting the independent pharmacy space. So I'm assuming with this HIPAA, which is, pretty widespread with independent pharmacies, I'm assuming now I would need to have a business associated agreement with each pharmacy that is a client. Is that what I'm thinking?
That is usually what is recommended. And I would say it is something that actually they, as the covered entity in this case, should be asking of you.
Right.
If they don't ask for it, I always recommend that you be the one that pursues it, because a common misconception is that signing a business associate agreement causes you to take on additional liability. That is not the case. If you are yourself HIPAA compliant, the signing of a business associate agreement actually limits your liability. Okay, it puts you in a position where if your client has a breach, you can't be audited or held liable. But also if you have a breach, your client can't be audited or held liable. There's a case study we could talk about even a little bit later about that.
Yeah, plus it lets them know that I know that, HIPAA compliant is an important factor in their business. So by helping them comply adds a little credibility, I'm assuming, right?
Absolutely. Yeah, adds a lot of credibility. And pharmacies, it is a unique space because you're really combining what could be a healthcare environment with a more traditional retail environment. So half of the people in that business might not have any exposure to patient information, meaning the manager of that business might not really have any awareness of the HIPAA rules either, is what can commonly happen. So just be cognizant of that. Yeah.
I got you. Well, thank you. Appreciate that.
Hey, my pleasure.
Let's go with Jordan Meggs.
Hey there. So my question is going to be around, we're signing BAAs with the groups we work with. We're working with some dental offices, some mental health folks, and we're fully HIPAA on high level. But the question is beyond high level with Twilio. I've seen they've got that tier as well. And since a lot of this data that we're getting is going across to Twilio, is that next level needed, or at what point is that next level needed?
Yeah, well, talking about Twilio sometimes is it could be kind of like talking about Bigfoot, right? Sometimes because every time that the topic of Twilio comes up with the agencies, I actually hear different things. So the answer is, and it actually, and Paulson, I don't know actually how this works between Twilio and the way that they interact with your platform. Usually you would need a BAA with Twilio. Getting the BAA with Twilio, though, from what I hear, can be a little bit of a headache because before they'll sign a BAA, technically, they make you upgrade to their enterprise program, which is really designed for a much larger company. And so what tends to happen first time you get on the phone with a sales guy there, they'll quote you an astronomical number to actually sign a business associate agreement. And you have to like really stay on them to actually get on the phone with somebody that knows what they're talking about. So, and then they'll tear it down, right? So it is recommended. Whether or not I could say it's absolutely needed, it just depends on where the data is being stored, right? Because if all of the data is in high level, from a storage perspective, different schools of thought, but it is recommended.
Okay, so the transmission of it is as important as just the storage. Is that a way to think about it?
I wouldn't say it's as important. It's just a different angle, right? Like I would prioritize where it's being stored, but still you would want to make sure that everything is secure, because technically Twilio is not storing any information themselves, as far as I know. Okay. So it's, kind of a tangled web there. I wish I could be more helpful on that, but
thank you.
I recommend that you speak with them. Yeah. Okay.
So let's continue onwards on the slides, and as more questions come, Liam, we could keep going.
Yeah, absolutely. I always pause there because usually once we get to the basics, there's a bunch of questions that we can kind of get out of the way right off the bat. So, and I'll start by saying that generally speaking, there's two angles of this that you could look at, right? As far as HIPAA compliance is concerned, because as an agency, you need to be looking at this from the angle of the services you are providing, right? And if you're using high level, that's fortunately pretty easy because you could just upgrade to their HIPAA compliant program. And then all of the technology is secure as far as that goes. That makes things pretty easy. The other angle is thinking about this more from the administrative side, which I'll highlight here, which is that under HIPAA as a business associate, you actually should have your own policies, procedures, and trainings for the HIPAA rules, especially for your staff, right? Making sure that you're doing some type of risk assessment yourself, primarily just to limit your own liability so that you actually have clear documentation of your own compliance program. So conducting an assessment, having your own HIPAA policies, procedures, and trainings established, going through those processes is a good way, let's say supplementary to the actual services that you are providing, just to make sure that you actually have clear documentation to back yourself up. Really important. Now, I'm going to talk about some, call them key value propositions within the healthcare space. And I'll say a lot of these things that we could bring out make High Level's SaaS platform especially powerful if that's how you're selling it to your healthcare clients. Because you can see this slide, the way that digital presence impacts medical practices. There's a lot of data here, but ultimately digital presence really helps a practice not only acquire new patients, but most often it's something that they actually use to improve patient retention and alleviate the fear and some of the misconceptions about the healthcare space in general, which we could talk about in a second. Overall, 72% of people say that they actually go online as the first step in finding a new doctor. 19%, even after picking a doctor, will go back online to validate their choice. And the interesting thing that's happening within healthcare is that where a lot of the perception around healthcare has really changed in that it's turned into much more of a consumer type of environment, right? So just like if I don't like Verizon and I'm looking for a better experience and I want to switch to AT&T, I'll do that. It used to be your doctor was your doctor, but now if somebody doesn't like their doctor, they consider switching, right? And they go online and they're looking around. And so for all of those reasons, digital presence in general for medical practices is extremely important because it's how they are able to really leverage their reputation within the communities that they're in, right? In a survey, when asked about different areas of technology, 62% of patients say that they want to communicate with providers through email. 64% of patients say that they would like to actually schedule their appointments online, patient scheduling. 61% of patients say that digital services are important when choosing a physician. And 2 out of 3, this is actually a really interesting one to me, but 2 out of 3 patients say that they would switch providers just to be able to have access to their medical records online. And when you're, let's say, as a medical practice looking at some of this, getting involved in some of these different areas is hugely intimidating. Because you're dealing with an industry where 10 years ago might have been mostly paper records, and the government has incentivized them away from that to more electronic-based platforms. But even still, things like email, online scheduling, digital services, all of that really is a frustrating experience for a practice. And you have a really powerful opportunity to help meet some of those needs. Even I would actually take a screenshot of some of this data, use this in your conversations with your practices, because sometimes understanding the way that their patients perceive them could be a really powerful thing. And with that, another interesting angle is that 68% of patients would say that they are not confident that their healthcare provider is protecting their medical records, right? And in the healthcare industry in general, they're often dealing with a very, very negative curve, right? And you'll see 53% of people that experienced identity theft actually said that their healthcare provider's negligence caused or contributed to it. Because just in general, healthcare gets a bad rap because they're hearing about all of the breaches and fines and the issues that are happening, a lot of the mistakes that occur, but also they have more information about their patients than really any other service provider has, right? To kind of illustrate that, a single healthcare record can be sold in the black market for anywhere between 5 and 10 times more than a debit or credit card number. And reason being is because if they're billing insurance, they have their social security information. It could be used for identity theft. It could be used for blackmail. It could be used for any number of things. It's really valuable data. And part of the angle, so let's say when I'm speaking with a healthcare practice or with you as agencies, is that something that is really cool about the opportunity that you have in servicing your clients is that you can help them really overcome that negative curve, right? Something I say to practices all the time is that 68% of your patients walking in your door don't believe that you're doing what you're supposed to be doing as it concerns their privacy and security, statistically. Imagine what would happen in your practice if that number went down to 0, right? And part of that is not only in their own right, addressing their HIPAA compliance, because that's important, but actually building a stronger online reputation, even talking on their website about the things that they're doing to protect their patients' privacy and security. All things that are super helpful that a lot of practices are not aware of, that makes a big impact on their bottom line, just from a retention perspective, as well bringing practices in. What kind of prompted this actually was that there was one particular HIPAA fine that was levied just this past month that involved a marketing company. And so there's 2 quick case studies that we're going to look at from previous HIPAA fines from the OCR and some of the ways that this impacts you as agencies and the way that you could look at some of this. First one was to a dental practice, $10,000 HIPAA fine. Basically what happened was a patient came into the practice, had a very, very, very negative experience. They went on Yelp and wrote a really bad 1-star Yelp review for this practice. An employee in that practice went online and replied to that Yelp review and included a lot of information regarding the situation, like their full name, like their insurance company, trying to extrapolate out on what happened to make themselves look better, right? In the end, the patient was thoroughly put out. They reported them to Health and Human Services, and the practice was ultimately fined $10,000 because in the confirming of all of that information, they actually violated that patient's privacy, and they couldn't prove that they had policies and procedures and training in place that employee would have attested to as part of their HIPAA compliance program. And some of this, when it comes to online presence, you hear stories like this, especially from the perspective of a practice. And this is the type of thing, which is why a lot of practices don't engage in marketing at all, because they have a lot of fear. They're hearing things like this, right? The interesting thing is that, and I'm giving you this information so that you could even use this in your own conversations with your healthcare clients. Most of these situations is very simple things that the practice could have done to avoided it. Meaning, if all that they had was the HIPAA policies that they were required to have in place, and they were training their employees, they would have never been fined. But in general, especially in through platforms like social media, important to make sure that everything is kept anonymous, right? So even if I'm a healthcare practice and somebody leaves a positive review, I can't reply and say, hey, thanks for coming into the practice today, John. Really appreciate the review. The fact that I just used John's name and confirmed that he was coming into the practice could be considered a HIPAA violation, right? So even talking to your clients about how to avoid some of those types of things, making sure that if they ever have a written testimonial from a patient, they have consent for that. All that stuff is really important. And in general, when replying, it's important to not post anything that confirms the identity of a patient or sharing of a diagnosis or a service. Don't, even if they use it in their own review, not repeating any of that data. As online reviews, super important thing to leverage. Is just an important thing for practices to make sure they're being cognizant of. Now, the one that ultimately prompted this was actually another dental practice. Small practices, especially, I'll say, about 80% of the HIPAA fines last year were levied towards smaller practices. This is a dentist in Alabama that shared roughly 5,000 patients' information with their marketing company, okay? This marketing company actually started running a campaign, not for the services associated with that practice, but because the dentist was running for a local political position. And as a direct result of that, they were reported to the OCR. They were investigated. But the reason they were fined is an interesting one. And you'll find that this is the case pretty much across the board. Let's say if a breach happens, there's never actually been a fine in the history of HIPAA that was levied because of the breach. It's always levied because they were missing some part of an effective compliance program, like a business associate agreement, or they didn't have policies and procedures in place, or they didn't do a risk assessment. In this case, there was a bunch of those that the practice got dinged for. They were ultimately fined. I'm highlighting this actually because an interesting thing is that there was really no repercussions against the marketing company themselves, right? All of the liability, and again, they had a business associate agreement in place with this company. It just wasn't covering the specific usage they were using them for because he was running for local office. The marketing company didn't receive any repercussions in this case. And so an interesting thing to think about as you're taking these different angles with your practices is that you, as long as you have a BAA signed, are going to significantly limit your liability. But oftentimes what your practices will be looking for from you is for genuine input and advice on how they can limit their risk and their liability. So a lot of what we've been talking about is just to give you some ammo and how you can help them do that, even through things like online review sites, making sure that you have a good, solid business associate agreement in place that covers your scope of work. All of that stuff, really important. And a couple of key questions to actually ask your clients as you're getting into some of this, just to say, bring awareness rather than just say from the approach, rather than just trying to sell your product, taking a more consultative approach. Just asking them what their online presence looks like, right? Are they using online review sites and social media? If they are, do they have established social media policies that all of their staff is attesting to? That's one super important thing for them to mitigate their own liability, because then even if an employee does something that they shouldn't, as long as they, as the practice can show that they have a solid social media policy in place, they can't be held liable if an employee does something that was dumb. right? Another thing that every practice should have, if you ever notice this, they should have their notice of privacy practice posted publicly on their website. Another really important thing when it comes to building websites within healthcare practices, that notice of privacy practice should be linked on their website, displayed prominently, somewhere where all of the patients can have access to it under the HIPAA rules. Another good question is, do all of your patients sign communication consent forms? And this is an important one depending on the services that you are providing to your clients. But let's say that you're providing things like email, SMS, you're running campaigns to their patient base, things like that. If a practice tells you that they don't have their patients sign communication consent forms, that is a very big red flag. That should be the first thing that anybody signs when they walk into any medical practice, because otherwise the practice, technically speaking, under the HIPAA rules, can't email them, text them, period, at all, okay? So just to get a gauge on your practice's existing processes and what they're doing, and this could really be an opportunity just for you to educate them and ultimately upsell them, even on the services that you're providing, getting a gauge on what they're looking for, what their needs are, right? All of that stuff could be very important. And again, with all of this, there are going to be the services that you are providing. What ultimately matters is that your practices are HIPAA compliant themselves, right? They are responsible for that. You are only responsible for your own business. This is just to give you some ammo in your conversations with them. But also within your own businesses, really important for you to make sure that if you are providing these services and signing a business associate agreement, a business associate agreement only limits your liability if you are HIPAA compliant yourself, right? If you have your own HIPAA policies, a business associate agreement, if you've been doing an annual risk analysis for the HIPAA rules, all of that documentation is really important for you to have in place because otherwise, in the event of a breach or an audit, you wouldn't have any way of supporting yourself, right? You have to have your own documentation for your own compliance programs just to make sure that there's no potential liability there going forward. And that alone is what makes a HIPAA compliant marketing company so valuable to any healthcare practice, because even though there are some of those hoops that you have to jump through, it not only justifies, let's say, a more premium rate for the services that you're providing as compared to another marketing company that might not be HIPAA compliant, if it differentiates you really powerfully within a space that is oftentimes not super competent when it comes to the HIPAA rules. And so even just with a couple of questions that I gave you, you might find actually that even just after this webinar, you are more competent when it comes to HIPAA than even your practices are, because the industry as a whole is not doing great with this. That's a powerful thing for positioning yourself as really a trusted advisor as compared to just a marketing agency, right? Or a salesperson talking with these clients. It big time helps with your long-term relationship, client retention, because that's tough for them to find anywhere else. So I give that just to shed some color, give some insights here.
I got a few questions that are coming in. I think that'll help the conversation. Two important ones.
Yeah.
One, how do you differentiate between a lead versus patient, right?
Well, that's actually a part of the issue, right? So if you are generating leads for your practices, you more than likely would not even know when that person becomes a patient, right? So let's say somebody fills out a web form or they request information through Facebook or through an ad, whatever it is. That person is not a patient yet, so their information is not PHI. You have no way of knowing, though, when that person actually enters into the practice, right? There may be some visibility there, depending, but just say theoretically. Because as soon as that person becomes a patient, they walk through those practice doors, now you have protected health information in your system, right? Which is why, in general, it's a good best practice to make sure that your processes overall, wherever that data is going and being stored, is done in a way that's compliant, because then you don't have to worry about it.
Got it. What about existing patients versus prospective patients? How do you differentiate the two as a, I guess the question is HIPAA required for existing patients or just potential patients as a marketing company?
So as a marketing company, and this is going to vary depending on the services that you're providing. So if I was having a conversation with one of you, we could dig into this a little bit. But in terms of information that is considered PHI, it's only the existing patients of that practice, right? That is considered PHI. A prospective patient isn't the patient yet, meaning that that data is not considered protected health information, right? They're not providing services yet. They're not billing insurance for those patients within the practice. So it's not considered protected. The difficulty is that as a marketing company, you might have involvement on both sides of that equation, right? Meaning you might not know when somebody is turning from a prospective patient into an existing patient, which is why it's generally a good best practice for your processes across that spectrum to just make sure that it's HIPAA compliant in general. You're actually muted, Paulson. Can't hear you.
Oh, I've got two more questions here that I think will help. I've got a question from Nick Holt, and then David Goldstein have a few questions that I would love for us to cover. Nick says, can you cover the basic best practice for acquiring a customer list via high level for a med spa / doctor's office? Since if it is patient's info like phone number, name, and email, the client wouldn't email the agency the list. Rather, they would upload the list directly to our website via high level correct. Like, what is the best practice of acquiring that data once, I guess, you become HIPAA compliant?
Yeah. Actually uploading it into high level is probably the best bet in that sort of a case, right? So as long as you're on the high level HIPAA compliant platform, the upload into high level is probably your safest bet as compared to doing an email, because then you have to worry about things like email encryption. You have to make sure that you have a BAA with Gmail or with Microsoft if you're using Outlook platforms and things like that. So probably the upload into high level would be your best bet from a HIPAA perspective, just to make sure that all of the data is kept in a place that's secure and is verified compliant. Can't hear you, Paulson.
David Goldstein, sorry about that. David Goldstein, if you want to unmute yourself and go through some of those questions, I think you brought some relevant good points. Are you able to do that?
Yeah. Hey, can you hear me okay?
Yeah, we can hear you.
All right.
Yeah.
I turned on the video, so hopefully you can see me too. Thank you, Paulson. Appreciate you taking my questions. This is fascinating. Just one quick thing. I just sent a note to the group. I would advise that I use Dropbox to bridge between the patient records. If the doctor uploads into Dropbox, you can grab it there, and then from that into a high level, just as a tidbit. My question, a couple questions. One is there a good practice to integrate within back and forth with EMRs and go high level? And then also, can you speak a little bit about the protections we get when running campaigns through go high level with the HIPAA platform?
That might be something I need you to cover, Paulson.
Yeah, so for us, what we cover is what's inside high level, right? So if you're using Mailgun, Twilio, whatever other system and platform, those are relationships that you got to figure out with them. But to Liam's point of storing information, that's what we're covering, not necessarily the distribution, right? So you have to decide what is the right way to go about it, and figure out your policies internally as your agency. Now, the other thing I will tell you, and I'm sure Liam could add to it, there's no such thing as 100% compliancy, because every system has the ability to be hacked into, right? So there's no such thing as pure compliancy. We're all practicing towards the best perfection that we can. But when you sign a BAA with us, what we typically do, from what I understand, and I know Chase and a couple of the other guys cover a lot of the technical ground on this, so don't take all my word for it. You want to speak with them as well, and our marketplace team. But what happens is your account gets moved to a separate server that's completely just compliant for HIPAA altogether. And I don't think it runs on the main thing. So because of that, you would lose, there will be limitations on your account on integrations and things like that. And the transfer of data doesn't just simply happen like the normal agency account. So the reason why we have that HIPAA compliancy upgrade is to be extremely aware and alert of what is actually being transferred in and out of your account. And here's the cool thing. Once you go HIPAA compliant in your agency account, then I'm sorry, somebody else is here. Once you go compliant with that agency account, then typically, from what I know, all your sub accounts are compliant as well, because the agency account is compliant, right? So the storage of it is all in one universal. So you're getting one heck of a discount, just to be frank, because we can charge $297 per sub account, like a lot of the other platforms, which we don't do, right? So you're getting a lot of bang for the buck, to be frank. But from what I understand, the distribution of these messages and campaigns and things like that, those go through Twilio, Mailgun. What are the other providers people use? If you set up your own AWS and SMTP, we can't control your setup, right? So, the other is Sendinblue. People integrate with Sendinblue and a couple of the other providers, right? So we're not able to control everybody's altogether system. Now, it's going to be interesting when the Twilio ISV comes out, where we are going to have a consolidated Twilio account for all agencies if you want to be part of that, right? So at that point, we would have to obviously look at HIPAA as a whole and figure out, how do we make 5,000 agencies compliant all at once? That's probably the closest answer I can provide you without knowing everything myself, right? So you want to talk to Shivam, our product manager, Chase, Robin, Alex, and also have multiple sources and take my information with a grain of salt. But hopefully that gives you some idea. Oh, sorry, you're muted. You're muted, David.
Sorry, I was just saying thank you. That really cleared it up. You broke it down nicely. Thank you. And I don't want to hog this, but just a quick question I'm sure a lot of people have for Liam. Do you provide a program or a package for agencies to make sure that you have everything you need and annual audits and whatnot? Thank you.
Oh, yeah. So basically what our company is, we are kind of like the idea of having QuickBooks or TurboTax, but for your HIPAA compliance program, right? So what we do, we're a web-based software company ourselves. If you came on board with us, we would pair you up with what we call a compliance coach on our side, who would meet with you and actually get you set up inside of our platform so that we can get your HIPAA risk analysis conducted. We provide you with all of your policies and trainings that can then be electronically distributed to the staff. We'll provide you with a business associate agreement. All of that gets done right inside of our platform. So if any of you need help on that front, absolutely, you can shoot me an email. Happy to help.
Thank you.
Also, David, our own agency, the high-level agency, which you see as marketplace, right? We're all compliant as well. There's, altogether, 220 plus employees. Almost everybody have to go through the HIPAA training every single year, go through the whole program that Liam and his teams put together. I mean, we do that annually. So since day one, when we first initially launched HIPAA as a option, the Compliancy group has been our go-to partner all in all. And trust me, we've done plenty of shopping before we went with them and decided they're the right people that understood the agency model. They're from the software world. They understand the medical side. And what I loved about them is they're focused on liberation, right? Like in the sense of like a lot of the other agencies and people that we spoke with, it was more like, oh, you're doing this wrong, that wrong, everything's going to collapse, it's the end of the world. That was the mentality. And what these guys are doing is positioning you to actually have ammo go into your marketing clients, your prospective clients, and help them understand what's at stake, and really provide the best practices, right? So it was a refreshing angle from them, and because of that, we said yes, yeah, let's do business for a long time, and we're still doing business. So once a year almost, like, right, Liam, like you guys jump on a quick webinar like this with us and educate our crowd, and we throw it on our membership areas and YouTube channel, and agencies directly go to them as well. We don't have an issue with that. We're not the only agency that they work with or platform that they work with. They understand the space very well, and doctors don't have a choice but to go compliant as loud as they can with all the social media. Like, if they don't get on social media, they're going out of business. Like, we all know that, right? So this type of competency is very, very necessary, and you get to be the forefront of it with somebody like Compliancy Group backing you up. So yeah, definitely. He did not pay me to say all that, I promise you.
Yeah, thank you, Paulson. That was great. Thank you.
GDPR compliance, that's a whole different ballgame, guys. This is a HIPAA webinar. We probably should have another webinar on GDPR. Unless, Liam, you guys don't cover GDPR stuff, do you?
We are actually proactively working on getting it rolled out. I'll say my own expertise when it comes to GDPR, like you said, it's a little bit of a different ballgame. There's a lot of oddities when it comes to GDPR. Wish I could be more helpful on that front, but might be a little bit before we have that.
Got it. Yeah, I mean, once you guys have that in place, I'm sure we'll be working close hand in hand. Regardless, guys, somebody had posted the Compliancy Group link in the chat, in the Zoom chat. Feel free to reach out to them, do sessions and calls, and do a assessment of your own setup, right? Whatever your agency is doing. And I get this question all the time. Hey, Paulson, my team is remote team members from 5 different countries. Do I force them to go through compliancy training? And what I would recommend is, figuring out what is the level of interaction you have, how do they really, do things with you, and you want to really take it at a one-on-one approach. Every scenario is different. Like, the advice that Liam may give me for our company is going to be drastically different versus your software company, right? Because the level of involvement and the complexity of how things go. Let's see. Anybody want to unmute and ask any more questions? I see a ton of questions that are coming in.
I was going to say, Paulson, real quick. We actually have a landing page created specifically for high-level agencies. That way, if you guys wanted more information, that would route you to the right places.
Yeah, what is the link for that, Liam? I can just post it for you, or you can post it yourself.
I'll send it in the chat. We could take the next question while I'm doing that.
Yeah. Let's see.
Hey, Paul.
Yeah, go for it.
Yeah, this is Patrick. Hey, thank you, guys. This is very valuable. Quick question. I have the high-level HIPAA upgrade. We work with dentists. We do not manage any of their marketing initiatives. Basically, all we offer is the SES access. We don't push the buttons on their behalf, none of that. Do I still have that BAA, or what's the exposure level, I guess?
You're storing their information, right? So yes.
Even though we have the high-level HIPAA upgrade.
If you sold them a folder with papers and they put a bunch of patient stickers on there, right, and that's all they had, because you're the provider of that folder in this context, it'll be the same scenario, right? That's my personal thought when it comes to dentistry, because I had a dental agency. I don't trust them to take care of anything, so I want to be proactive to do that. Liam, feel free to answer.
Yeah. Well, just so you know, so if you ever in your own conversations, for those of you that have worked with us in the past, just so you know, we are the exclusively endorsed solution of the American Dental Association. So most dentists actually will know who we are if you're using like our documentation and things like that, which is another good, powerful thing. I'll say that the fact that you are providing them with a software, right, that is going to be storing patient data that you could theoretically be accessing makes you a business associate, right? Because by law, they would have to ask you to sign a business associate agreement since they are using you as a third party to store that data. Same reason that you would need to have a business associate agreement with High Level on their HIPAA platform, right? So it's the same, it's really the same thing, even though your services are a little bit different.
Gotcha. Thanks.
Yeah.
That's a good question though, and it's typically taken lightly because a lot of people think, oh, here's my tools, you're on your own, you signed up for it, right? Like, but the thing is, they don't know any better, right? So it's better to be proactive and responsible and just get in front of it and say, hey, listen, we are HIPAA compliant. Here's why you should consider this, you know? And that's going to position you to be a multifaceted provider versus just a SaaS provider. So in the long run, when they're ready to launch Facebook ads or Google ads or SEO, they're going to think of you over anybody else. And that's what you have to remember. Let's go with Abigail. I know Abigail had her hand raised for a while. Abigail,
yes, and then I lost network, I guess, contact. But anyway, my question is in line of the previous question. So all I'm doing for my client is resell campaign just to email, their clients. I don't get the full medical records. All I get is their name, phone number, and email address. I mean, is that still considered part of what would require me to get a BAA?
Yes. So there are 18 identifiers under the HIPAA rules. First one is actually just their name. I think email is number 4. Even actually their IP address is considered PHI, right? It's less, the actual treatment information is not what's considered PHI itself. It can be. It is the fact that they are seeing a covered entity, and that is their personal information, meaning it's protected, right, under the HIPAA rules. So it's really the same. I would say risk level is lower, right? The less information you have, because there's less chance of all of that information and data getting out there. But you absolutely still have exposures on that front.
Oh, thank you.
Yeah.
Yeah. Also, another note to think about is if you are a international entity, let's say you have an agency in Canada or Mexico, and you're catering to medical clients that are in the U.S. dealing with U.S. patients, you are essentially just as liable, from what I understand, because you're serving within the U.S. territory laws. Is that right, Liam?
Yes. So even if you are an internationally based agency providing services to the U.S., you have it's the same implications because you're acquiring ultimately what is U.S. patient PHI, right? And in the signing of a business associate agreement through the providing those services, that's what puts you under the HIPAA rules.
And by the way, guys, we're here to share information for your benefit. I know you guys are, some of you are a little worried or distraught. The intention is not to stress you out. Intention is to empower you, okay? Just so you know. So feel free to jump on a one-on-one, get on another call with Liam and his team and figure out what your use case scenario is. It's much better to be proactive, and this is the world of proactiveness, and that's really what HIPAA makes things a lot different. Let's go with Steve Baker, Jesse Nelson, and then Joe, and we'll call it a day. Let's go with Steve. How are you, Steve?
Can't hear you, Steve. Yeah.
How about now?
There we go. You good?
Okay, cool. I guess I had the wrong mic turned on.
That's all good.
I've been putting together as a potential clients a group of addiction recovery clinics, and of course obviously we have to have them on a HIPAA compliant platform, but they have their own system that they use for tracking patient notes and patient billing and all of that kind of stuff. This would be mainly just for lead generation and then communication with their clients. But do you have any input on I was told that we can't run any kind of ads or anything without getting some additional licenses through another third-party agency. Do you know anything about that?
Paulson, I can let you tackle.
Yeah,
tackle
I
that
don't
one.
know. I don't know what you mean by that. Are you asking to high level whether we allow you to run ads, or do you
No,
mean by, like
no. I just thought, I think for Google or Facebook ads, I think they require some other kind of license. I didn't know. It's not directly relevant to high level, but I just wondered if maybe you knew something about it.
so all platforms, right? All
Yes.
platforms that you ever use for any
Right.
advertising, you have to get a BAA with them if you're gonna ever upload any kind of PHI or extract something that could be considered PHI. For example, let's say you run lead ads or conversion ads, and you ask a bunch of medical questions in those ads. Now, when you're downloading that information, now you have to be careful of how you're downloading it, right? So
Right.
it just depends on the platform policy. This is why a ton of medical entities lean towards Google, because they're a lot more HIPAA aware, and I don't want to put any other platforms under the bus, but they will sign a BAA with you and help and work with you, right? So the permission is not necessarily, a high level permission or anything like that. It's based on the platforms of how you behave in those platforms. So, but at the end of the day, anywhere you acquire something that's considered medical data, you have to be aware of how it's transferred, right? Whether it's if a guy is standing outside on the corner of the street and he gathers up a few people and asks him a bunch of medical data, if he sends over a phone call, now that's PHI too, So you got to really, just giving you some elementary examples, my, dumb self, but you get the
Right.
example though, right?
Yes, I do.
Okay.
Because generally with Google, once you have a business associate agreement, there's usually some limitations that you could that are put on you as far as the ads that you can run, especially for things like retargeting. Because retargeting off of an IP address, that could be considered PHI, that could be considered a violation of privacy. So Google tends to be a little bit more, they're very HIPAA aware, meaning that, and again, like Paulson said, with everything that you hear from us, the goal is enablement, right? Not restriction. So all that I could do is just help, bring some awareness around what's out there. But the best person to answer that question in this case would be Google themselves. You want to actually talk to them to see what your options are. The addiction recovery space has some uniqueness to it because they also fall under another reg called 42 CFR, which is a different beast as well. So that would be, so just some different things to consider there. Yeah.
Yeah. Oh, Steve, I had muted you again because there was some background noise. What were you saying?
So I would definitely need to get with you then, Liam, if I'm dealing with those guys.
If you want to, yeah, please.
Oh,
We'd love to chat with you.
There's a link in the chat, guys, so you can all jump on a call with Liam or his team or whoever's there. We're going to close this out pretty shortly here. I'm going to go with Jesse Nelson and Joe Tran, and then rest of the questions, I would encourage you to put it on the comments, okay? Jesse, where are you checking in from, man?
Atlanta.
Oh, nice. Go ahead.
Cool. So yeah, thanks for the webinar. It's really informational. So my question is concerning like DBRs or review campaigns. If we don't use personalized information, but we get the information from like a dentist or whatever, how does that fall in relation to all of this? For example, if we just send, they say, hey, here's 5,000 people that have been our customers, names, emails, phone numbers, but we don't identify as far as like the text message sent out. We just say, would you please leave us a review? This is so-and-so chiropractic or whatever. How does that fall?
Yeah, so as long as you're using methodologies like let's say HIPAA compliant SMS through high level, through Twilio, on that front, you should be good as far as the actual messages that are going out. The nice thing about review campaigns is that once the patient actually goes on Google or Yelp or whatever it is and leaves a review, that's out of the practice's hands, right? They don't have to worry about that. That's the patient doing that. Same thing, if a patient is interacting with them on Facebook, they're limited in what they can say, but ultimately they can't be held liable for something that the patient goes online and says and does, right? So review campaigns are great. The only thing that you need to be careful of is that you can't then take those reviews. Like you'll see it sometimes where there's like a running thing of their Google reviews on the practice website. That is actually not allowed because they don't, unless you have the consents of all of those patients leaving those reviews online, it can get you in trouble. So if there's a patient that's leaving a review, it's an easy enough thing to just say, hey, when you come in, we'd like to have you sign this form so that we could put the testimonial on the website, right? Stuff like that. So the consent forms and overall the review campaigns is a great idea as long as the way that you're sending those messages is compliant.
All right. But as a marketing company, we still need to have the BAA and make sure that we're verified with Twilio and all that kind of stuff.
Yeah.
Cool.
Yeah. You also don't want to allow or recommend the practice to confirm the reviews. Like, glad you came in and we took care of your infection and gave you a new Invisalign. You don't want them to confirm even though the patient volunteered their own medical info. Because if you reconfirm that, you're now saying that was an actual patient or not, right? So there's also, your responses to those reviews and things like that cannot be, repurposed like that. You got to be careful. Even though the patient has raised their hand and said, yes, I'm going to put my business out there, don't allow the practices to reconfirm.
There was actually a practice that had it was a physical therapy practice, had a patient that mailed them a personal note, super nice, saying all these great things about the practice. The practice took that note and put it up on their website. And the patient was pissed, okay, because it had all of our personal info on it. And they were fined because she reported them. And it was actually a nice testimonial, right? They just didn't get her permission before they used it. So that's one thing you just have to caution them to be careful. Yeah.
Let's go with Joe Tran and then Akil, and we'll call it a day. Joe, if you want to unmute.
There you go. Oh, much better. Okay, so I'm dealing with practices that may start off as a medical practice and they're expanding their capability to go into aesthetics. So for example, let's put in the general practice, and now they want to get into cash practice. And if they don't have a distinction like, hey, I'm starting a new business as something kind of med spa, then that will be absolutely I need to get a HIPAA compliance with them or have a BAA with them, right? Because then I'm dealing with, even though it's a cash type business and they're doing some kind of aesthetic thing for cash, but they themselves started off as, a regular practice where they, bill the insurance. What's your opinion on that?
Yeah, because even if they're transitioning off of billing insurance, all of the existing data that's in their system is PHI, right? And is covered. Usually what I would recommend to a practice like that is if they really want to transition to more like aesthetics, med spa, wellness type of a thing, cash practice, they should really have literally make a new corporation or an LLC specific just for that cash practice and add all their patients to that. That way there's a clear distinction there. If that's not what they're doing right now, and you're providing services broadly to all their patients, you don't know who's, let's say, paying cash, who's billed through insurance, you want to be careful with that because more than likely across the board, there's going to be some exposures there.
Okay, and one more follow-up question. Say it's a dentist, right? And they want to run, say, a Christmas special, right? And they want to use the marketing company to do email and SMS. Hey, we're running this, free teeth cleaning special to their list. So, Paulson, so now if we're the marketing agency, we get that data. We're within HIPAA compliance because we have the data in the system, but to send it, we got to have, Twilio. We need to have a BAA with Twilio and BAA with Mailgun, right?
Yeah.
Okay. Otherwise, it's okay. So
I mean, like, so remember HIPAA compliancy from high level. What is it? What is it actually, right? It's us saying we're going to store the data in here properly for you. We don't distribute the data, right?
Right.
The distribution is ran through multiple, telecom companies, right? At the end of the day, that's the way we have set it up. So because of that, it's not too difficult for us to throw ourselves into the HIPAA compliancy pocket and make sure we're covered there. So how do agencies tackle this? They consolidate together, like few of the medical agencies combine together and they go to Twilio, and a group of people will say, hey, we're sending out this many XYZ messages. Can we get compliancy? There was another gentleman in here in the chat, if you scroll up, said, hey, I negotiated my deal down to $500 a month with Twilio. And like Liam said, their salespeople are trained for enterprise partnerships and enterprise dealings. So you have to help them understand what is it that you're really looking for, and help them understand you're not a Fortune 500 company that's competing with AT&T, because that's usually their clients, right? So once they understand that positioning, they'll really get the context and set up something with you. But there are agencies that basically put five agencies will get together and get a massive account with Twilio to kind of combat that. But at the end of the day, there's few different angles of it. Again, that dentist that's giving you that list, they have the ability to give you that list. There's nothing limiting them, as long as you're following the HIPAA compliancy policy. You have an established, relevant practice, and then when you get audited, it's more like, hey, here's what I'm doing to make sure my practice as a agency is compliant, and what you're looking at is areas of improvement, right? And that's what you're really shooting for, because at the end of the day, 100% compliance doesn't exist. Everybody is hackable. Everybody is liable for an intrusion anywhere, right? What we're trying to do is limit it as much as we can. But I would say, you have to set the standard of how a DBR could be ran, right? You want to counsel them of like, hey, before we run the DBR, here's how I would like for you to put together the data. I want you to upload it all into high level instead of emailing it to me. Maybe some people may not feel comfortable with the Dropbox thing. I don't. I never did. So I wouldn't tell them like, throw it into Dropbox or Google Drive. I'll have my team look at it. I would have them directly go right into high level, because I know that's a safe route, right? So really the storing and handling is where people go south. It's not anything else that really get them in trouble. It's like the labeling, right? I remember 2016 we had to label, like if you went into the funnels of a system, right? If it all said patient from XYZ, patient from here, right? There's a thing called I forgot the terminology. I don't know if it was chain, where if somebody looks at the data and they can identify it by labeling that it's medical data, then you're kind of killing the purpose of it, right? Like it could be all your folders that just says Invisalign patients, cool sculpting patients, sleep apnea patients, and now if a hacker looked at that screen, you're letting them know this is where the data is, right? So there's even like labeling practices that I'm sure Liam and his team goes over in detail when you get on a call with them, but hopefully that gives you some insight, Joe.
Okay, thanks. This has been very refreshing and at the same time kind of freaked out, because for the whole time we're going, if the information reside within high level per se, and we don't put it in we don't touch their patient management system or something like that. We consider that it's a lead and they're not a patient yet. But what you said, Liam, is when they become a patient, now that data within high level, that with their name, before they became a patient, or maybe it was just a lead, then could be compromised. So that could be a potential problem.
Yeah, and that's why. So in the first place, you definitely, again, from a storage perspective, you want to be on high levels HIPAA compliant platform, right? That's a no brainer, because then even if those people become patients, it's already stored in a HIPAA compliant environment, so you don't have to worry about it. And then the only other thing that you need to be concerned with is the other types of services you might be providing, right, and how you're going about that, as well as your own agency and your own documentation.
Okay.
Yeah. And honestly, Joe, it's, I mean, I understand your feeling, because I remember 2015, me discovering the whole HIPAA thing, and I remember around that time it was like nobody had any right information, right? It's like one person was saying one thing, one person was saying another thing, and you're just kind of in this limbo of one marketer saying one thing, another person saying something else. But it's now I feel like we have very good information of what's the right practice, right? And I promise you something that'll be fascinating to you. Your medical practitioners don't know any better. Don't trust them on giving you the proper HIPAA advice. I want you to do your own research and understand their practice and then advise them. Like, for example, like a Botox could be provided by medically. They can be provided by a dentist, a chiropractor, a nurse practitioner, a standard nurse, a plastic surgeon, an internal medicine doctor, a ER doctor, and standard aesthetic esthetician. I mean, I can keep going. There's like 9, 10 titles of somebody that can actually, legally by law, say, I provide Botox injections. Right? So you have to really study the clinical component of like who is who. Like, they can tell you they're retail. Doesn't mean they are.
Well, Liam, do you provide that guide and education in helping us clarify? Because I feel like now I'm going to take on clients that are, if they're transitioning from a medical practice to a cash-based practice, and they don't have a separate system, I don't feel like I even want to deal with that. It's like,
Yeah. Well, I'll say that, so we are not, let's say the services that we provide, we're not lawyers or consultants. What we will do is help you get your agency to a place where you feel super comfortable with your own compliance program. That way, regardless of the engagements that you have peace of mind, right? Knowing that you have all of the documentation that you need to have in the back end in case anything ever went wrong. Because like what Paulson was saying before, once you go down this rabbit hole, right, there's always additional things you could be considering. But remember, what HIPAA requires is not that you be 100% compliant. It's not possible. You have to be able to show clear documentation of what the government calls good faith effort, right? That's all that is required.
oh,
Meaning
okay.
for what is required
That's great.
under the HIPAA rules is that you be able to show, hey, I did the required HIPAA assessment. I implemented policies. I executed BAAs. There's going to be things that are always a work in progress, but as long as you have clear documentation to support yourself and your efforts, that's what the government wants to see, right? The flip side of that is negligence. That's when people get fined, right? So a practice who replied inappropriately to a Yelp review wasn't fined because of the Yelp review. They were fined because they didn't have the policies that they should have had. They were fined because they didn't train their employees, right? And so what we would do with you is make sure we get you to the place where you're at least comfortable to know that all of those bases are covered. There are going to be ancillary things in there. There's always going to be the outstanding stuff. But again, our goal is ultimately enablement for you as agencies to help you operate your business in a way where you feel comfortable and competent, that you're not taking on additional liability, but adding unique value to the clients that you're serving, okay, is ultimately the goal.
Okay, great. Thank you, Liam. We'll definitely be touching base. So
Let's go with Mike Barnwell and Akil, Aquil. Guys, I'm gonna do a hard stop in about 5 minutes because I know the recordings get really long and big, and my production guys get on to me about it. So we're gonna do a hard stop in 5 minutes. Okay, let's go with Akil, AQUIL. I don't know if I said that right.
You said it perfectly. Thank you so
Okay.
much for taking the call. And I came late, so I apologize if this has already been covered. And I think that my situation, I'm hoping, is pretty straightforward. But I work with a number of cardiovascular groups, and they run condition specific landing pages. So like for vein screenings or heart health screenings. And ultimately, they're just trying to book appointments to bring these people in to be patients. And so on my end, I'm developing the landing pages, and then they have an agency that's running the actual ad spend. What I'm wanting to do is to streamline the processes. Once those leads come in, what's happening is that they're just getting the email, and they have a call center that calls the people, and then they're manually tracking the engagement of like, they called this patient, and it's just like a manual paper process to determine whether or not that patient actually turns into or that lead turns into a patient or in a particular appointment. And what I want to do is build it into a system where they can notate this electronically, but more so that I can start building out marketing and email campaigns to these people. And so I wanted to know, just in general, it's been difficult for me to get a lot of information about how marketing agencies are running email marketing campaigns in the healthcare space and what platforms facilitate that so that it can be done, in a compliant environment. So, they have patient engagement. This particular organization has patient engagement platforms that they aren't leveraging. They've got a bunch of, they've got their EHR and nothing is talking to one another. But I've been tasked with building out an email marketing campaign, but then also kind of managing a lot of these landing pages and leads that are coming on. So if you just have anything that you can share with me, that would be appreciated.
So technically speaking, so as long as the data is stored in a HIPAA compliant, right, platform like High Level. So let's say they fill out that form, the data goes into High Level, you're then processing the campaign. The only consideration that you need to then have is the tool that you're using for running that campaign, which could be Mailgun, Twilio, right? Any of those options. And if you're doing that, it's then just a matter of executing the business associate agreement with Twilio, which, like we've said, could be a little bit of a headache. If there are other alternatives to that, Twilio, tends to be the best option for the most part, from what I hear. That would be really the only thing that you need to be concerned about as far as those campaigns.
Okay, perfect. And then, so like, for example, one of the issues that I'm running into is on the actual websites, sometimes people are putting patient PHI into the contact forms. And, so like my hosting environment for websites that I'm doing for these agencies or for these organizations, I don't have HIPAA compliant hosting. So obviously, if somebody's putting PHI and they're putting information about their prescription or what doctor they're seeing and all of that kind of stuff, that's actually being stored on my WordPress installation, which is problematic.
That would be, yes, absolutely.
Correct. And so what I've done is I've removed the free form forms. And so like now you have, it's like a question that says, what is, 7 + 2 or whatever, and you have to put 9. But then what people will do is they'll still put their PHI in after that form. So in those cases, I guess my best option is just to try to find HIPAA compliant hosting or.
So you have two options technically, because you could find HIPAA compliant hosting, or you could find a company that just does compliant web forms.
Like High Level.
Like High Level. Yeah.
There's no hosting. It's all inside the system.
Yeah. So if that's an option, that'll help you out significantly, because
it is perfect. Yeah, I just got connected with Go High Level through one of my other clients, and so I'm new to Go High Level, so I don't really know everything that it does. But that's why when I saw this webinar come through, I'm like, wow, this is the answer to my prayers. So,
hey,
is there going to be a replay to this?
Yeah, it's going to be on YouTube pretty shortly, so you'll be able to watch it on whatever speed that you want to. But when you go into high-level HIPAA compliancy, what we do is move that account into a dedicated server, from what I understand, and it's the integrations. Some of them gets turned off and all kinds of stuff. So it doesn't run like the normal accounts. And once you go HIPAA compliant, I don't think you can go back. So that's one of the bad things about it. So if you are committed to going HIPAA compliant and going all the way to medical, then I would say it makes sense, and that covers all your sub accounts as well, because we're complying you at the agency level. But either way, guys, it's, and I know, Akil, you're focused on the tools, but what I would love for you to focus on is the behavior as an entity yourself, right? It's the behavior that they really pay attention to, not necessarily the tools. They're not focused on like, here are all the tools you did, but they focus on how you transfer data in between, and what were the checks and balances you had for your staff before they took part in these activities. Like, that's really the key thing that you want to really embrace, is the behavior of your agency as a whole serving a medical client. It's not the tools that people are overly focused on. Does that make sense?
It does. Thank you so much.
Okay. Liam, any final words in the link? And if you want to just share, let's do that and close out the call.
Yeah, so I actually, I'm going to have a meeting that I need to jump on very shortly here. If you have specific HIPAA questions, because I see that there's still a couple of raised hands and some people that were in the chat, I did send a link to my calendar. So if you wanted to just set up 15 minutes and I could help you address those questions, it's my pleasure. Anything that's more HIPAA specific, anything specific to high level, I would direct you to chat with them, right? But overall, yeah, again, the focus here, it's all enablement, right? So anything I could do to help y'all be successful, I'm happy to do so. But that's it.
Thank you, everybody. If you want to be notified more often about education events that we do, masterminds, in-person events, virtual workshops, go to gohighlevel.com/education, and you'll be able to get the best information there on the upcoming events and schedules and things like that. Liam, thanks for joining us once again.
Yeah.
We appreciate you as a partner, and looking forward to doing cool things with you guys.
Yeah, no, that's great.
Take
Thank
care.
you, everybody.
Bye, everybody.